So if you look at 100 years of longevity research, calorie restriction, which is something very simple, it's actually, if you take a normal diet, normal calorie diet, and restrict it by 25%, so calorie restriction turns out to be the most successful intervention, I will argue, ever, right? And so to slow down aging, but also combat diseases. And so the first study on human calorie restriction was done by Roy Walford, the bald guy at the bottom of the picture. And Roy was a medical doctor at UCLA. He was my boss back in 1992, 93. And so Roy decided to do the first clinical trial on human calorie restriction. So he locked himself up in this Biosphere 2 area in the desert of Arizona near Tucson. And for 2 years, they did a calorie restriction study. So they just reduced calorie intake by 25%. They also had a very healthy diet, but I mean, that's not the idea of calorie restriction, right? So if you look at systolic blood pressure, they're a fairly healthy group of 8 people. Systolic blood pressure drops from 110 to 90, glycemia from 95 to 70, cholesterol from 185 to 125. So you can look at this, and if you're a cardiologist or a doctor, you will say, this is great, right? And then you look at Walford on the left when he came out of Biosphere 2, and you will say, if you're a doctor, this is not so great, right? So it's being pushed to the limit, right? And so now the question is, how do you keep all these incredible effects of calorie restriction, really revolutionize medicine, right? If you could change cholesterol, blood pressure, and not just this inflammation, this calorie restriction really goes after almost anything that you can think of that is bad for you. But it comes with a big cost, including lean body mass loss, bone density loss, potentially immune system, certainly dampening of certain functions of the immune system. Okay, so back then I started thinking, how do we keep the good effects of calorie restriction without the bad that I just mentioned? So I developed first I started thinking, well, can you intervene for just 5 days, let's say, of fasting once every month or 2 months or 3 months, and that's it, and then let the person go back to their normal diet, and then can we do it, not with water-only fasting, can you do it with a fasting mimicking diet, right? So that's where I, thanks to the funding by the NIH, develop a low-calorie, low-sugar, low-protein, high-fat, vegan, 5-day-long fasting mimicking diet, and without going through the markers, but we were looking for fasting response through 4 markers, IGF-1, IGF-BP1, glucose, and ketone bodies. The first trial was at USC, 100-patient randomized crossover, and you see on the right is the result after 3 cycles, monthly cycle of a 5-day fasting mimicking diet. So there's a major reduction in weight, abdominal fat, waist circumference, but unlike the GLP-1 receptor agonist drugs, you don't see the absolute lean body mass loss. You see that muscle is preserved, maybe a minor loss, but muscle is preserved, and fat. This is cycles of FMD are targeting fat without affecting negatively the muscle mass and the bone density. Also, something interesting, differently from the calorie restriction, if you look at, just give you a couple examples, glucose in normal subjects, there's a small reduction, I don't know where it went forward. So there's a small reduction in glucose, but in pre-diabetic subjects, most pre-diabetic subjects now go back to the normal range. So it's differential effects, which were not seen by calorie restriction. Same thing with cholesterol. Those that had cholesterol below 200, so relatively normal, they have a decline after 3 cycles of the FMD. It keeps going forward. And those that have hypercholesterolemia, they have a much larger benefit of the 3 cycles of the FMD. Now, University of Heidelberg did actually a trial on diabetes patients, and they compare 5 days of a Mediterranean diet with 5 days of a fasting mimicking diet, thinking maybe it's just a healthy diet. If you do once a month a healthy diet for 6 cycles, 6 months, you're going to benefit. But as you can see, no effects of the Mediterranean diet on hemoglobin A1C, but also no effect on insulin resistance. But the FMD instead has a major reduction of A1C, 1.4%, also a major reduction in insulin resistance, But the most important thing at the bottom is diabetes drugs and hypertension drugs, right? So the FMD is able to allow 70% of the patient to reduce drug use, either the dose or completely get rid of drugs. And this is not seen in the Mediterranean diet, where you actually see 30% of patients increase the use of diabetes drugs. And but what are these? Why do we see these effects on hypertension? And as I showed you earlier, with even calorie restriction, lots of effects on lots of different systems. And so we started looking at reprogramming, cellular reprogramming. So we knew that there's something called autophagy occurring after fasting. We had shown that stem cells are increased. But we are also very much interested in this reprogramming. This is probably the hardest thing in aging research, right? Can you turn on these Yamanaka factors and all these embryonic developmental factors and make an old cell young, right? And this is what is now being done by biohacking, by lots of different methods. So when this is a few years ago, we published this paper where we damaged the pancreas of a mouse. And you see in the left at the bottom, you see that red. The red is insulin-producing beta cells. And then you see where it says STZBL-D5, a lot of the red is gone, and D5 is day 5, D50 is day 50, so it's permanently gone. So we now damage the pancreas irreversibly. But now, after irreversible damage to the pancreas, we start with the cycles of the fasting-mimicking diet. And you see that at the right, the pancreas goes back to normal, right? Now it's making the insulin-producing beta cell are regenerated, and the insulin is produced, and now the hyperglycemia here comes down on the left at the top. And why is that? Well, it turns out that you see those 3 columns. The first one is a little bit, meaning the mice are eating normally. The middle one, where it says FMD, is at the end of the 4-day fasting mimicking diet, in this case for mice. And you see all these red colors. It means that the embryonic developmental genes have been turned on, right? So now, in a coordinated way, including Yamanaka factors, in a coordinated way, the fasting refeeding cycles are turning on these regenerative embryonic developmental genes and repairing. And now, is this systemic, or is it just a few organs? Now we've shown it for the gut, we've shown it for the kidneys, we've shown it for the pancreas. And so in collaboration with Morgan Levine, who's now at Alto's lab, we looked at biological age. What happens after 3 cycles of the fasting mimicking diet, monthly FMD? And it turns out that, I don't have much time, so I'll shorten it. People become 2.5 years younger, at least according to these markers, these blood markers, which include cholesterol, blood pressure, A1C, C-reactive protein, et cetera. Okay, so then to end, because I have 1 minute left, to the FMD, which is at the very bottom, right? Let's say 1 to 3 to 6 cycles or so of FMD a year, depending on who you are. Then I wrote a book called The Longevity Diet. And the longevity diet is based on lots of different parts of science or fields of science, including epidemiological studies, centenarian studies, mouse studies, areas of the world where people have record longevity. So it's mostly plant-based, plus fish 3 or 4 times a week, low protein until age 65 or 70, and then moderate after, lots of legumes, whole grains, vegetables, healthy fats, no red processed meat, low eggs, low sugar, low refined grains. And this is up to age 65, 70. Then most people need to expand. And we think the Mediterranean diet now becomes maybe a better option, right? Just because it's safer, it's more nutrients. And so, let's say, longevity diet until 65, then Mediterranean diet after, wine 3 a week, fine, 3 glasses a week, high nourishment, eat within 12 hours a day. A lot of you have heard about the 16-hour intermittent fasting. It's a bad idea. We can discuss it later if there are questions about that. But the 12 hours is certainly a very good idea, not a negative study I've ever seen. It doesn't work as quickly as the 16 hours, but it's much better option, much easier option. And then, if overweight, we recommend, we follow a lot of patients in the foundation clinics. We recommend 2 meals plus a snack until you go back to normal weight, and then you can resume your 3 meals plus a snack. Thank you.
Thank you.